So postnatal depletion is a collection of symptoms, health issues that one can experience after giving birth. And it may, we'll talk about how long the effects of it can last, but it's basically when the body has been depleted after giving birth, and particularly, a lot of it is based off of what your postnatal care life is like. But the depletion is when you've, given so much from your body and that you have a variety of health issues that happens afterwards. Is that clear, Dominique? Did I make sense there? I hope so. Okay, please let me know, because we're going to be talking more about it, but please let me know if that was clear. So the big thing is postpartum depression. Postpartum depression. It's basically like if you're sick after you have a child, unless it's like mastitis or something related to producing milk for the baby, like insufficient lactation or something like that, or unless it was something that happened soon after having the baby, it's like it must be postpartum depression. And it's estimated, there's like a whole estimate of 11 to 20%. It's estimated that 11 to 20% of women have are said to have postpartum depression, right? And that some people say that would be approximately, if you go in the middle, like around 15%, and that that actually, some of the experts who have studied this have said, well, maybe it's not postpartum depression for those women. Maybe, in fact, they're just depleted, and that there are certain nutrients that affect your emotions, your body, and if you don't have enough support to do what you need to do, how are you going to feel? So postnatal depletion, postnatal depletion and postpartum depression, two totally separate things. So Dominique, if you're still there, please let me know if I answered your question. Sorry I didn't get to answer it right away, but I was trying to lead into it. So if you're there, please let me know if how I define postnatal depletion makes sense. So that's like a whole big myth, another big myth about the postpartum depression, that's the only thing that can go wrong with your health, that if you don't feel well after a certain period of time after having a baby, then it's just postpartum depression. Not just, but that it's postpartum depression. And actually, I was looking at some of the things that's put out by, different medical organizations, and there really isn't things that's put out about that I found in terms of postnatal life and illnesses that can happen, except for what I said, soon after having the baby or postpartum depression. And experts who have studied this are saying that there's more to it than that. So 1, 2, 3. Myth number 4. I didn't have any help when I had my baby's children, and you don't need it either, right? So there's a whole myth that, if, one generation has struggled with the keep up of their postnatal care life, then, it's sort of an initiation for you to figure it out. Well, in places all around the world, there's more community and more that gets to happen in terms of more togetherness, more assistance, whereas here we're so much more isolated. So that's a big myth in the postnatal life, that one person didn't have help, so you don't need it either. And the last one, which one of my patients would joke with me about after I had my child, was that forget you, it's all about the baby now, that came from the Cosby Show. And that is what we tend to do as mothers, is forget about ourselves and focus on the child. But if we don't take care of ourselves, it's not great for our child either. So, is everybody with me? Okay, I hope so. So let's see. And there are many other factors. Just trying to do a time check here. There are, oh boy. Okay. There are many other factors here. Oh, thank you. Oh, this is so sweet. I've never done Facebook Live, and I just see thumbs and hearts going across. Thank you for all of that. Who did that? Thank you. So, so there are a variety of factors that contribute to it. I think the suffering in silence and the myths, particularly the myths, lay a terrain that create postnatal depletion or make it, how do you say, that further postnatal depletion. And there are a bunch of other factors as well. There's your health before you were pregnant. There's, the support that you got. There's what type of labor you had. There's all different factors. But I feel like the first thing we have to do is really have more conversations about, what it's actually like to be a mother, and actually what is the type of support that it might be good for someone to have when they have a baby. I think that it has to be more just more common talk. And then also in our current society, there's just such an emphasis on the result, on the product. It's like once you have the baby, it's like, okay, like there's all these things about when you're pregnant, which is very important because you want to make sure that the life that you're carrying is fine and that you make it. But it's not like that's it for us, and our health is just fine, or it's all in our head. That's not true at all. Can you go an extra 10 to 15 minutes? I don't know. Hi, Karen. Hi. I'm going to keep talking, though. Then this is going to be a replay. We're going to hopefully have a replay of this. Hi. Okay. So there are all these different factors that contribute to it. And, it's not commonplace information, or at least it's not being spoken about. And I have to say that as I started doing my research, I wish I could show you. This was so pretty. Okay, you can't see the words. They are backwards, but isn't the colors just so beautiful? It's not giving it justice. I was so happy. Thank you. This is so fun. See a heart going by. It's so fun. I like that. It's very nice. If it wasn't backwards, you would see this is a list of experts that have put out information on postnatal care. There's so much, but it is not. It's not kept to the forefront, and I feel like a lot of that, is about sexism. I do feel like there are lots of, I forget which research it was, but it has shown that that with certain conditions that happen more so with men, that those will get more funding as opposed to what happens with women. But I feel like a lot of it is that it's just, this is what we do and this is what we've done. But I ask now, just because it has been done, is that what should be done going forward? So this list is of a number of people who have put out information. So the article that I read on postnatal depletion was from goop.com by a Dr. Oscar Saralak, who's based out of Australia. Then Dr. Richard Hansen in California, him and his wife, they put out a book called Mother Nurture, and they termed it depleted mother syndrome. There's a Dr. Dean Rafalak out in Colorado. He put out work called Postpartum Nutritional Depletion. The Berkeley Parents Network, they refer to it as Postpartum Exhaustion or Postpartum Affliction. So these are things, there's no regrets, right? I mean, if you're a mom, or once you become a mom, a parent, that's like your heart, your biggest joy. You would do it, for all I went through, I would do it again. No question about it. It's just good to have information, because if we can make something better, don't we want to, right?